Welcome, patients. My name is Akshi. I invited you here today with a matter of urgency. There's been a misconception going around among patients that robotic surgery, specifically those done by the Da Vinci robotic system, are superior to that of normal surgery. This idea has created a lot of problems around the world and has been a burden to your pockets. But before we get into that, let's explain how robots got involved in surgery in the first place. After all, it's very important for you guys to be able to understand why robots are not always the best option. Throughout time, mankind has made advancements to the process of surgery. For example, in this picture in the top right, we have a painting of a man getting head drilled, which is a procedure commonly used to treat any head injuries such as migraines or brain trauma. And at the time, they thought this would relieve pressure on the head, which we know today is not true. Towards the bottom left image, we see the invention of anesthesia, where we have found how to use a certain gas in order to put patients to sleep during surgery so that they do not feel pain. Inventions like anesthesia throughout time have made surgery the modern, safe procedure that is well informed that we have today. In the beginning of modern surgery, a widely used method was open surgery. In open surgery, surgeons made large cuts to operate on the patient in order to operate on the site of interest. For example, you could see in this picture on the right, the surgeon is operating on the heart and has made large incisions in the patient's chest in order to have a clear view of the heart so he can operate on it. However, this results in more post-surgery scars as the entire chest is being cut by the surgeon. And this results in more post-surgery pain and complications and overall a longer recovery time. This caused people to ask, is there a surgical procedure that could be much less invasive than open surgery? Years later, there was an answer, and that was laparoscopy. Laparoscopy, unlike open surgery, is much less invasive on the body, and this is because small cuts are made in the body in which tools can be inserted by the surgeon, one of which is a camera that allows the surgeon to see the interior of the body. Using the tools in the camera, the surgeon can operate on the site of interest without having cut the entire body with large cuts. This is a much less invasive surgery that results in less pain, scars, and recovery time after the surgery is completed. In 2000, an invention called the Da Vinci robot was released by Intuitive Surgical. Intuitive claimed that this robot could do minimally invasive surgery just like laparoscopy. In order to do so, it consisted of 3 components: a console, robot, and screen. By operating a console with their hands, the robot would mimic the arm motions that the surgeon was using in order to perform surgery on the patient as the surgeon desired. In order to see what was going on, there would be a screen that broadcasts the surgery to the surgeon so he could properly conduct the surgery. The disadvantage of the Da Vinci robot is it costs $2 million and despite that, it has become widely used across the country. Many patients have come to surgeons saying that they would like a robotic surgery just because it's high tech. However, I want to tell you patients that it's not worth it. After many years of using the Da Vinci robot, studies have found that it does not actually have a significant advantage compared to non-robotic surgery. Several studies done on cancer outcomes have shown that in the long term, there is no difference between surgery with the Da Vinci robot and traditional open surgery. This means that when cancer patients were analyzed who had open surgery and Da Vinci surgery performed on them, their long-term health was similar in both cases, despite the robot being used. And this comes as patients are paying 3 times as much to have the Da Vinci robot performed on them. So they are paying. You patients are paying 3 times more money than you should, compared to a normal procedure that has the same benefits and same outcome. So you might be wondering, how does Intuitive Surgical continue to stay in business despite its marginal benefits in surgery? And the reason is because Intuitive has been marketing to you guys, the patients. They have been saying that they have been advertising their robot and making it seem like it's a high-tech, very efficient robot that will always be a safe and efficient procedure for you guys. However, as we have discussed in studies before, that is not true. But you patients have been coming to hospitals and asking for the Da Vinci robot. And this has caused hospitals to buy Da Vinci robots so that they could attract patients in order to stay in business. This, however, could hurt low-income groups, and this is because this competition for patients can cause hospitals to go out of business. There are some hospitals in the world that cannot afford the Da Vinci robot, and as a result, patients do not want to come to their hospital, causing the hospital to close. However, there are still some low-income groups that are dependent on these hospitals, and closing these hospitals puts them at risk. A study has shown that competition among hospitals has contributed to the closure of 25% of prostate cancer centers in England. This is problematic for all low-income groups in England and across the world. And this is why it's so important for you guys to understand that robotic surgery is not necessarily the best. And I'm not saying that robotic surgery done by Da Vinci is always useless. There are some cases where it's very helpful. For example, during pancreatic surgeries, where the pancreas, shown in yellow in this diagram, is operated on, it is frequent happening that the green organ here, which is the gallbladder, is damaged and must be removed. And this is very unfortunate, because the gallbladder plays a huge role in the immune system, meaning that if it's removed, patients can get easily sick. The Da Vinci robot, however, has been shown to have a high preservation rate of the spleen. As shown in this graph here, we see that Da Vinci has a 95% chance of saving the spleen, while traditional laparoscopy only has a 64% chance. So in conclusion, there are pros and cons to the Da Vinci robot, but most of the times, it's not always the most efficient method. And the company is making money off of you patients constantly requesting the Da Vinci robot. And it's also costing you guys more as well. Whenever a new technology arrives, it is important to ask if it's worth the cost, and if it's actually beneficial compared to traditional surgery or other technologies. I hope you found this session informative and I have opened your eyes towards the disadvantages of robotic surgery. Have a good day.